Hello friend, welcome to the channel Pharmacy Dictionary. In today's video, we are going to discuss about some important historical landmark and development of pharmacology by some pioneer scientists. This video is all about their contribution, their hard work, their effort for the development as well as betterment of pharmacology. So let's start their contribution. First of all, I would like to discuss about Sir Ostwald. He has considered as a founder of modern pharmacology. Modern pharmacology means utilization of different tools and techniques along with the gadget to exactly estimate the strength, power, efficacy and pharmacological property of any drug. So this is called modern pharmacology. He also studied the estimation of chloroform in blood. Chloroform means an agent which is included under the example of general anesthetic. General anesthetic are those drugs or those agents which is used for the reversible blockage of pain perception in any individual. Although chloroform is example of general anesthetic, but alone it is not fully effective for the general anesthetic point of view. So it has to be combined with other drugs to maintain anesthesia. But if someone taken chloroform as a general anesthetic or any other purpose, so the drug will reach to blood circulation, and the estimation of that particular chloroform in particular patient blood is given by Sir Ostwald. He also explained the hypnotic effect of urea derivative and along with paraldehyde. The primary action of digitalis on heart muscle has been discovered and explained by Sir Ostwald. Digitalis is example of cardiac glycoside, and we know it very well that digitalis has important effect on the muscles of heart that may cause contraction, so that it can be used as a drug in case of congestive heart failure, and that effect of digitalis is given by Sir Ostwald. That is a big contribution in the field of cardiovascular pharmacology. So next important contribution of Sir Ostwald was effect of nicotine on cardiac vagal ganglia along with central and peripheral action of caffeine and other toxic effect of heavy metals. Heavy metals are considered as a toxic material that can be either lead, mercury or arsenic, so there is chances of their ingestion by accidental or by intentional. So the effect of this heavy metal on the normal physiological process of body's organ is considered and studied by Sir Ostwald. Coming to the next scientist, that is John Jacob. He used to isolate the epinephrine from adrenal gland extract, isolation of histamine from pituitary gland. He also discovered the preparation of pure crystalline insulin. Now we have to study all this point one by one. What is the meaning of isolation? Isolation means removal of pure form of chemical from any part. So he has isolated so many chemicals like epinephrine and histamine. Histamine is a local hormone that is also called as adenoids. They act when any foreign molecule contact the part of body, and the response is allergic response or allergic behavior. He has also extracted the preparation of pure crystalline insulin, which is used to maintain the glucose level inside the blood. So insulin is very important, but the crystalline form insulin was discovered or contributed by John Jacob. Coming to the next one, that is Thomas Richard Fraser. He has isolated the active principle of calabar bean, that is called Physostigmnine, which is used as the antidote for many poisonous substance, which will be seen by Sir Thomas Richard Fraser. Next one, John Newport Langley. He postulated a receptive substance on nerve stimulation, the basis for the neurotransmission in neurotransporters or neuroreceptors. So what is the meaning of neurotransmission? Neurotransmission is a process in which there is a transmission of signal from one neuron to the another one, so that the chemical signal that is called messenger signal may convey from one part to the other part. That is applicable for the neurotransmitter only, and the neurotransmitter get attached or bind to the neuroreceptors. That is called neuroreceptor neurotransmitter combination or collaboration. Next one is Otto Loewi. He showed the cardiac inhibition that was due to the discharge of acetylcholine upon the target effector cell in the heart. That means there is a cardiac inhibition, and that was due to discharge of acetylcholine, which is an example of neurotransmitter. Next is Paul Ehrlich. He is one of the most important scientists who have given almost everything to the betterment of pharmacology. He is father of chemotherapy. This is one of the most important question for your GPAT exam. Kindly note it down. He is called as a father of chemotherapy. Chemotherapy is used for those phenomena where we have to inhibit the growth of microorganism, or we have to maintain the particular growth rate of microorganism to prevent the infection. Another chemotherapy is utilized where there has to be inhibit the growth of cell, that is called cancerous cell. There are two types of cell present in our body. First is normal cell, which replication take place as per the regulation process of our body, and the second one is called cancerous cell, which continuously multiply and start growing, and the control of body is not over them. This is called cancerous cell. He also used the arsenicals in the treatment of syphilis, and he also done some experimental work with the tumor, that means cancerous cell. That is why he is considered as a father of chemotherapy. Next scientist is Alexander Fleming. You have already heard about their contribution in field of microbiology. Now we are going to study about their contribution for the betterment of pharmacology. He discovered penicillin. What is penicillin? Penicillin is one of the important antibiotic which is used to inhibit the growth of microorganism. He discovered penicillin in 1928. So these two questions may be asked in your GPAT examination. This was a serendipity. That means he was not intended to discover the penicillin, but due to some accident he discovered the penicillin. When he observed that a mold was developed accidentally on the staphylococcus culture plate, and he had created a bacteria free zone. So this was a great contribution in field of microbiology as well. Next scientist is Selman. He discovered streptomycin. Streptomycin is another important antibiotic. He discovered streptomycin in 1943. Again, important question. He was also responsible for the isolation of other antibiotics such as actinomycin, clavicin, streptomycin, neomycin, candicidin and candididine. These two are very important, and these are streptomycin and neomycin is very much important for the prevention of infection caused by different types of microorganisms. Next scientist is Sir James Black. He has discovered the beta blocker. Beta blocker is one of the most important drug for treatment of cardiovascular disease like hypertension, angina and many others. Beta blocker are those drugs which block the beta receptor. If they block the beta receptor, their chances of development of hypertension will be reduced. So acting on beta receptor, they give so many beneficial effect upon the cardiovascular system. Coming to the last contribution, that is Gregor Domag. He discovered the use of Prontosil, that is azodine, against the streptococcal infection, and later developed sulfonamide for the use against microbial disease. We can say that he developed two important antibiotic, like first one is Prontosil, which is a azodine, and that against on the streptococcal infection. After some time, he also developed a sulfonamide derivative for the treatment of microbial infection and different types of disease which has been caused by microbial contamination. So friend, that was a simple and short video regarding the historical landmark and development of pharmacology by different pioneer scientists. So thank you very much for watching video. Namaskar. Please do take care of yourself. Thank you.